Let's say you work in diabetes education. You have a new patient that's come to your clinic or pharmacy or whatever it is, and this is your first time meeting with them. Hopefully, one of the main aspects of your first initial encounter, especially if they're uncontrolled, is lifestyle modifications. We can give metformin, insulin, any of our go to medications. But if that patient has not changed their dietary habits or maybe become more active and they're still living in a sedentary lifestyle, then those medications are only going to do so much. So let's look and see how exercise directly affects a patient's A1C by looking at the results of the DARE trial. Now, a little off topic, my buddy Gleb, he's a fourth year student at MUSC. He actually helped me put this video together and helped me pull the data. So he was going to be the one to do the audio so you guys didn't get stuck listening to me all the time. But he's actually getting married this week and our schedules wouldn't line up. So congrats to him, and you'll hear him in future videos, I'm sure. To get things started, let's look at the current American Diabetes Association guidelines. They want patients to work out 150 minutes a week. They want the activity to be moderate to vigorous intensity. They want that 150 minutes spread over at least 3 days per week. And they also recommend that patients have no more than 2 days in between individual workouts. Now, the ADA also recommends that patients complete resistance workouts as well. And they say that 2 to 3 days of resistance exercise every week is beneficial. And they don't want those on consecutive days. Now, hopefully the first thing that pops in your head is, where did they come up with that? Obviously, it has to be evidence-based. So let's take a look at the DARE trial. What this trial looked at was aerobic workout versus resistance versus the combination of both. And they actually compared it all to a control group as well. Now, the inclusion criteria for this study, patients had to be 39 to 70 years old. They had to have type 2 diabetes and be previously inactive, so be living a sedentary lifestyle. They also had to have an A1C that was 6.6% to 9.9%. Now, patients were excluded if they were currently on insulin therapy, if they had participated in exercise 2 times or more weekly coming up to the study, if they had had any changes in oral hypoglycemics in the last 6 months, and also no more than 5% weight loss in the last 6 months. Now, like I said, there was 4 different intervention groups. The aerobic group concentrated on using the cycle ergometer or a treadmill, whichever the patient preferred, to do just aerobic activity. The resistance group used exercises that targeted large muscle groups, and they were actually using weight-bearing machines, so they weren't using free weights or anything like that. Now, the combination group, they completed both the aerobic and the resistance workouts, so they had to work out much longer than the other 2 groups. The control group only had diet restrictions. They were not given any kind of exercise program to follow. There was a 6-month follow-up, and the primary endpoint the investigators were looking at was the reduction in A1C. They also looked at secondary endpoints such as body weight, waist circumference, systolic blood pressure, and many others, but these are the ones that we're going to focus on. Now take a look at this table. With the aerobic group, we saw a reduction in A1C of 0.43. In the resistance group, we saw a reduction of 0.3. And in the combination group, we saw a reduction of 0.9, almost a full percentage point in A1C lowering. That's huge. That makes a great case when we are trying to get patients to start some kind of an exercise program, if we can show them this data. Also, these differences were compared to the control group, and all 3 groups met statistical significance. Now, in body weight and waist circumference, we only saw statistical significance when we compared the aerobic group to control. We didn't see that same difference with the resistance and the combination. And systolic blood pressure, unfortunately, was not significant in any of the 3 treatment groups. Now, if we take the combination group and we compare the difference between that and the aerobic group and that in the resistance group, we still actually get statistical significance. So we need to really be pushing these ADA guidelines that encourage both aerobic and resistance to our diabetes patients. And the resistance training doesn't have to be a large gym with a lot of machine equipment that these patients can use. It could be something as simple as a few pound dumbbell, or resistance bands are great, especially for elderly patients. Just something that gets their muscles contracting. That's all I had for the DARE trial. Please leave a comment if you have experienced this firsthand and seen patients really benefit from this combination. And also share any other ideas you have for certain exercises or resistance workouts that these patients can do. Really appreciate you watching, and I'll see you next time. Thanks.